Hey everyone, just coming in for a 1 week update. I was actually planning on doing it on Monday, which was day 7, and then I ended up getting a little bit sick, so we're delayed till Tuesday. I'm actually exactly 1 week after surgery today. The process has been kind of varying. I would say day 1, which is when I did my last video, I was up and about, really good. Was able to walk around the wing of the hospital really well, no problem. And then maybe in the evening on day 1 or the morning of day 2 is when I really noticed that the soreness started to kick in. So that it's felt like a muscle soreness, since they took out, here's the collarbone, and then the rib kind of lies right underneath here. The soreness is like right here, and then on the back part, kind of like directly through. And it does feel like you've worked out intensely, or like if someone's punched you. It's like a very deep muscle soreness. If you cough, it hurts. So I was on Toradol injections every 6 hours for the first 24 hours, and then they stopped those, and then they switched me over to ibuprofen 600. I was still having some breakthrough pain. We did some oxycodone, and that's what I actually got discharged with. So the regimen when I got out of the hospital, which was actually on Thursday, was oxycodone 1 every 6 hours for breakthrough pain that's not relieved with Tylenol. And they had me on 1,000 milligrams of Tylenol every 6 hours. Now with that, I refuse to do it every 6 because that would put you at 4 grams a day. And about a year or two, well, a couple of years ago, they actually switched the maximum Tylenol amount per day should be 3,600 milligrams. So what I had been doing was 1,000 milligrams, which is 2 of the extra strength Tylenol, every 8 hours. And then I was also doing ibuprofen 600, and they said that I should be doing that on a scheduled basis, not just as needed, but every 6 hours for 15 days. So then I was discharged on Thursday, maybe around noontime, and I still had a JP drain in. So that's a drain that they put on the side of your chest, underneath your arm, so that all of like the extra fluid and the blood can kind of drain out, and it's to be able to avoid a hematoma from developing. So I was discharged on Thursday with that drain, and then on Friday morning I was able to go into their outpatient clinic and have them remove it. What I did notice is that when I started having a lot of shortness of breath, and so I started having to I had to sit very upright. I had to sleep upright. In the hotel, I had about maybe 3 pillows propping me up, and so that was a little bit bothersome. When they did the surgery initially, they did a chest x-ray, made sure that there wasn't any of the pleura that was poked, so there weren't any issues of pneumothorax, nothing like that. So when I went in on Friday, they did another chest x-ray just to make sure, nothing had happened. And they said that there was something like a little bit of atelectasis, is basically maybe partial collapse of the lung, very small, and that's usually anesthesia based. And so what you do is deep breathing exercises. You're doing very deep diaphragmatic breathing. So I'll try to point it down. Diaphragmatic breathing, not from here where your shoulders moving up, but diaphragm. Hold it in, and then maybe about 8 to 10 seconds, and then breathe it out slowly. And they said do about 10 deep breaths every hour, and then also cough. So coughing hurts a little bit. It helps if you brace yourself with a pillow a little bit. So you would, for example, if you feel like the cough is coming, you could sit in a chair. I have my towel there, but you'd sit with the chair, kind of brace the back, hold the pillow, and then cough. And then that way you feel like there's some support instead of just resonating completely. So it does help. So I got the drain taken out on Friday, and then I flew back home from Minnesota on Saturday. And so that one, I had to plan my medications in advance. So I did my Tylenol and ibuprofen before I got on a shuttle. And the shuttle, because I had to go on a shuttle that was about maybe an hour and 10 minutes to an hour and 20 minutes to get to the airport. And then my flight wasn't until like 11:30, so I decided to do the ibuprofen and Tylenol before I got on the shuttle. And then I did like a tablet of oxycodone right before the plane took off to kind of deal with the unsettling feeling, because I couldn't stay seated in one position for a really long time. Came back Sunday. I was still noticing issues with the breathing, and so what we figured out is that in the beginning part, I needed to take oxycodone, ibuprofen, and Tylenol all together for me to get adequate pain relief. And then when I had enough pain relief, I was able to breathe better. So what happens is when I'm in pain, my body is subconsciously guarding, and it can make you feel like you're short of breath. So if you are experiencing anything like that, make sure you get the chest x-ray done, because oxycodone can also cause respiratory depression. It can slow down your breathing. So you don't want to take anything like that unless you know you're okay. But it could also be unmanaged pain. And I didn't realize it would manifest that way, but I got that fixed. And then, so I did that on Sunday, and that seemed to be better. And then on Monday, I decided, oh, I'm going to eat just really light. I was just going to have, I had a cup of coffee, and then I had like two slices of cantaloupe, thinking that would be enough for my medication. It was not. Do not try to, oh, I'm trying to lose weight or whatever. Eat a decent amount of food when you're going to have to take the meds, because otherwise you will feel very sick. I was basically nauseous all day and had to eat very, very minimally. And now I'm doing better. So this is technically day 8. This is 1 week after surgery. And I just took 2 Tylenol this morning, which was still kind of painful. I was kind of up and about for about an hour, and now I can feel like I'm a little bit short of breath and having a little bit more pain. So I'm going to just try to do it with ibuprofen at this point and see if I can get by without having to take the oxycodone, because I do want to be able to drive again and get back to my normal activities as soon as possible. As far as restrictions, the main thing that they told me is that I could not lift the surgery side arm more than 90 degrees. So I couldn't go up higher than this. I can stretch it to the side. I can move it across, but I can't go up higher than this. And then also not lifting anything higher than, heavier than 5 to 10 pounds. And that is mainly because I have an incision right here in the underarm, and that we were trying to avoid that the stitches are coming out or the wound separates and makes it a lot harder to heal. I had been released to do physical therapy after 2 weeks, and they told me as far as like an exercise regimen, I may be able to start running, walking, jogging, body weight exercises possibly at 2 weeks, but maybe better at 4 weeks. And then possibly even after 6 weeks, I could consider doing weight. I am very reluctant about doing weight because I think that that's what may have triggered my issue with thoracic outlet syndrome in the first place. But we'll see. I know that I am motivated, definitely motivated to start getting exercise again, because I can feel the difference in my body compared to when I was working out before and before the injury and to now. Before I go, I did want to give clarification about something. So I mentioned when I was in the hotel, I did have to prop up with like at least 3 pillows, and I had to sleep upright as well, especially when I was in a lot of pain. So I had seen something like that on YouTube or on one of the websites. So I invested in a wedge pillow. That may be one of your best investments at this time. So I wanted to show you what I had. So this is one that I got off of Amazon. It's this wedge pillow. And then it also has the option of adjusting the height. So you can move this down, and then you can change the grade of the incline. I had been using that for at least, I think ever since I came back, I've been using it very heavily, and it does help to take some of the strain off when you're trying to relax a little bit and you're in pain. On Amazon, I say it's very affordable. You just have to, it comes like in a box, and you do have to let it air out, and takes about 8 to 10 hours to get to its full capacity, but definitely worth it. Look into it. So hopefully that's clarified anything you've had questions about. If you have any other questions about what's happened to me this first week or how the experience was, feel free to comment below. Make sure to like, subscribe, share this with anybody who may be having any issues. Hopefully we can spread that awareness around. Thanks. Have a good one.